Plastic Surgery Secrets. We have a really famous plastic surgeon, Dr. Peter Fodor. Peter, welcome to the show.
Thank you very much, Dr. Bovino.
That was a past career. Now I'm a TV talk show host. But it's really fun to have you on the show, Peter. It's very generous of you to share all of your knowledge and experience with our viewers here at Grassroots. And I know that you're very well known in the plastic surgery community. And just without embarrassing you, I want to just tell the viewers that Peter was first in his class in medical school and was the past president of the American Society for Aesthetic Plastic Surgery, and he was also on the board of directors of the American Society of Plastic Surgery. He originally was born in Romania, is that right?
I am Hungarian, but born in Romania, that's correct.
Right, Hungarian, but born in Romania, and then your family fled the communists, and tell us a little bit about your background.
Well, about 1963, my parents and my three sisters were able to escape from Romania and spend a little time in Paris, about a year and a half before we were able to emigrate to the United States. And so I've been here for quite a while, just never succeeded to lose my accent.
That's it, but that's your sex appeal. And I'm going to tell a funny story about your accent in a few minutes. But you're extremely respected in the plastic surgery community. You've been on the forefront of many plastic surgery procedures. And I just want to tell a little anecdote about how my memory of Peter, because Peter and I go back more than 30 years. Peter trained at Columbia, at one of the Columbia teaching hospitals, which was St. Luke's Hospital, with Dr. Stark at the time, who was a very famous plastic surgeon. And I was training in ophthalmology at the same hospital. And I still remember, I have this vivid image. Peter and I used to do cases together, and the common cases that we did were the orbital fractures. And what's called a blowout fracture of the orbit, the cheekbone here, which is called the zygoma, gets depressed. And Peter would go in and raise it out so they'd have a normal cheek. And then I'd go under the eye and make sure that the rectus muscles that move the eye weren't entrapped. And I remember a vivid memory of us standing in the surgeon's locker room, both of us in our underwear, and someone telling me that you were, because you have this beautiful accent, that you were a Hungarian count. And I believed this for years. You're not really a Hungarian count, though, are you?
Well, actually, on my father's side, the family tree goes back to about 1357, and we have a family crest and was painted on dog skin. I only have a photograph of it, but I have it here in Aspen, in my Aspen house.
That's fabulous. I have to see it. So maybe you are a Hungarian count.
Well, I don't know.
Okay.
Those things.
Let's talk a little bit first, Peter, about we're a youth-obsessed society. I think every one of us wants to look better and younger than we do. It's rare to find a person who's happy with everything about themselves. What do you think about this trend? Is this going to continue? Are the baby boomers fueling this?
Plastic surgery goes, yes, it's a very popular specialty. There's a lot of buzz about it, and has been for a while, but never quite as much as there is now because of the reality television shows and other things. The big thing, and maybe we can accomplish a little bit of that today, is to separate the fluff from reality. What's really real in plastic surgery, what can be done, what cannot be done, what patients can realistically expect. But you're absolutely right, we live a youth-oriented society and also in appearances-oriented society. People who are younger looking, who are energetic, who are better looking. Studies been conducted to show that they have a much better chance in the job market, for example, than their counterpart who looks older, who doesn't look quite as, not quite as energetic. Also, we live in a society where it's a big exercise craze and diet, and I'm not saying everybody's doing it because unfortunately in the United States we still have a very major epidemic with obesity. But we have a great segment of the population who are very tuned into their appearances. They're very keen in taking care of themselves. They're very competitive in that way. And I think our society, because of that, is tuned towards plastic surgery and also what's called cosmetic medicine, which is a wastebasket term for everybody who's not a plastic surgeon but is trying to barge into the field. But you're absolutely right, that is the society we're living in. But the real problem is, and I just summarize it at times in one sentence, which is reality television shows in plastic surgery actually promote unrealistic patient expectations. And realistic patient expectations is one of the most important things that we wish to impart to every patient. So in that way, it's a major letdown. Another thing that audience doesn't usually recognize, that our average patients, and we just talked about this, you and I, a few moments ago, are pretty keen on their appearances. And they already have their hair done nicely, and they have dental care, and they had LASIK surgery, and they come in for a consultation with already having had those kind of procedures performed, and they take good care of themselves, they dress well. The reality television shows go at great lengths to pick people who never had dental care, who to be their candidates, who neglected their appearances, they never went to a hairdresser. They show them before in this very unbecoming setup and in the most unattractive way with lighting and everything else. And then they throw some plastic surgery at them, at times perhaps more than should be done in one sitting. And then they do their hair, and they take them to exercising, and they dress them, and they do their teeth, and they do LASIK surgery, no longer wear glasses, and then they bring them out in this glamorous appearance.
Right, in a Chanel gown.
Exactly, which really imparts a lot of unrealistic expectation to the naive viewer. Now, most of my patients are quite sophisticated. They come to my office. They say, I watch maybe this for the entertainment value, but I would never go to a plastic surgeon who's on that show. I, for that matter, have been asked to go on all of these shows, but because all of them are pretty much produced in Los Angeles, and I politely turned them down for that very reason.
Okay. Well, one of the phenomena that I wanted to talk a little bit about, because the whole baby boomer generation will be accessing more plastic surgery, is the cost. And it always surprises me. I got something in my email, unsolicited yesterday, and if you can zero, it said plastic surgery, looking your best is affordable, and you can get a breast lift, an augmentation, or a reduction for $4,800. Is this the kind of thing? I always joke with people that you shop for discount tires, not discount plastic surgery. To me, this is sort of like looking for a discount parachute. There are doctors out there who are offering discount services, but is that how people should be choosing a plastic surgeon?
Well, the answer is absolutely not. But as far as what's considered ethical and what is not considered ethical, it has changed over the decades, and I've been around long enough to witness this. So nowadays, advertising, as long as it's not some kind of misleading or deceptive advertising, is not considered unethical by our national societies. Maybe distasteful by some of the rest of us when you see something like this, but the field meantime is very competitive, and as a general rule, the guys who had the less training and the less ability somehow are the best at marketing their practices.
Yeah, there's an inverse correlation.